if they're going to pay attention to anything, this is what it is.
Got it.
You have about...
The lights come down.
Yeah.
Very ominous. Got
Listen.
it. By the way, both Michael and I have fidget stuff in our hand right now because this is how stressed we are about this topic.
Yeah. In a world.
Exactly.
So you have 3 weeks. About 3 weeks.
Wow.
From start to finish of treatment.
Okay.
So the second that it happens, the next step would be to call somebody.
Okay.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
It's the first Monday in the Ides of March, and that means it's time for Ask an Audiologist. I am one of your hosts, Kevin Ziener.
And I'm two of your hosts, Dr. Michael Squires.
Today's article comes to us all the way from Beaufort, South Carolina, courtesy of Dr. Meg Kalady of Kalady Audiology, and she has written about the very real, very possible sudden deafness.
Yeah.
So, Dr. Michael, as an audiologist, would you say that this is one of the more scarier things within your profession?
Oh, listen. So I'm going to give you a quick analogy.
Okay.
I may have talked about this before. The frog in the boiling water. Do you remember this?
I feel like you and I have a lot of conversations about frogs in boiling water, so sure.
Yeah, I feel like we've said a lot of things before.
Yeah.
So frog in the boiling water is how I relate sensory neural hearing loss, just a typical progression of hearing loss to most patients. So if you take a frog and you put them in room temperature water and set that water to boil, frog's going to do backstrokes until it dies.
Right.
Because it can't tell the difference in the temperature, right?
Right.
Because it's happening slowly. But if you take that frog and you pop it into some boiling water, that frog's going, get me out of here.
Yeah.
Well, in general, most progressive sensory neural permanent hearing losses happen like the first scenario, very slowly.
Got
so
it.
people are kind of in denial. They don't really realize that it's happening.
Got it.
Until everybody around them is going, the water's boiling.
Sure.
We got to get you.
Right.
We got to get you in to see an
We've been
audiologist.
screaming at you for the last 20 minutes.
Yeah. Sudden sensory neural hearing loss or sudden deafness is the second scenario.
Got it.
Where it's very noticeable, very fast, very alarming. Patients typically show up like something major has happened.
I was just sitting on the Barca lounger and now I can't hear out of my right ear.
Oftentimes I'll have patients tell me like, I heard a loud pop and now I can't hear anything out of this ear.
Scary.
It is. It's alarming.
Yeah. So here are some of the things, and I'll just read them, and I will read the long words terribly, and you correct me.
Yep.
You can tell me how realistic they are as it relates to sudden hearing loss, and or how totally obscure they are, but they've probably happened before.
Sure.
Okay.
We'll go. This is like the lightning round.
Yeah, exactly.
Let's do it.
Viral infections or reactions, like to chickenpox.
I would say that is probably more prevalent than most of the other things that are going to be on your list.
Okay.
Generally, when I see it coming from the medical side, it's related to a viral infection.
Got it.
Yeah. Still a pretty low prevalence.
Okay.
But
more
so than others.
Before we keep with this,
yeah.
How often, I think this is a better question, how often does sudden hearing loss, sudden deafness actually occur?
Yeah. I've been practicing, I'm coming up on 10 years in my practice, and I would say collectively across the now 7 audiologists that we have, we probably have less than 10.
Over the whole 10 years, over 7 different providers.
Yep.
Okay. So it's rare.
So not very. I don't have the exact prevalence right at the tip of my tongue, but I would say it's like 1 in 1,000 maybe.
Got it.
It's pretty, or 1 in 100,000 rather. Maybe it might be a little higher than that, but it's not super prevalent.
We're not fear mongering by saying this. People aren't going to all of a sudden be like, oh my gosh, I should be like aware that I could lose my hearing at any second.
No, they should be aware that it's a possibility. Yeah. But here's the thing. Okay, quick PSA on viral. Mm-hmm. We need to know what to do because the time frame for treatment is very, very small.
Okay, hold on. Let's get to that. Put a pin in that one.
Think.
Circulatory disorders like blood issues.
Yeah, circulatory disorders, they kind of go hand in hand. Cardiovascular issues, diabetes, all of those things kind of go hand in hand. I have not, in my professional career, seen that cause sudden sensory neural hearing loss. Generally, that's going to be a more progressive thing. It's a possibility. Have a blood clot in the ear or something like that.
Got it.
But
explain to me what a ruptured oval or round window is.
Yeah, so on either side of the... So, okay, we're going to get technical for just a second. I'm going to lightning round technical.
I love it.
The cochlea, the organ that's responsible for hearing.
Little snail shell.
Yeah, exactly. It has a round window where the stapes or the little ossicle, the smallest bone in your body, articulates, right?
Okay.
So the eardrum and then the other little bones like this, like a piston, that attaches to the round window. That pressure has to go somewhere. So if you go to the other side of that, there's another little, what we call a round window, which is covered, essentially covered by a skin layer.
Okay.
Right. A very, very, very thin skin layer.
Got it.
So as the piston goes in,
talk about thin-skinned.
whoa, as the round window or the piston, the stapes goes in, round window goes out. So it works.
Sure.
In the camera. Like that.
Got it. Got it.
So one of those things ruptures, all the fluid drains out of the inner ear, and you have no hearing.
Copy. Cervical spine injury, whiplash.
Oh yeah, I mean,
because that's just more of like a full blown jostling of the internal organs.
Yeah, that one's tough. I've seen some hearing loss secondary to concussion, something like that. Fracture. So you're talking like mastoid fractures, and depending on how the bone fractures, that can just sever the nerve.
Got it.
And that'll lead to deafness there.
Got it. Occlusion.
That's going to be wax.
Sure.
Go have it taken out.
Okay. Copy that.
Yeah.
And
don't do it at home.
Then just like autoimmune diseases.
Yeah. Again, pretty rare in terms of causing deafness, but I've had a couple. Got a couple patients.
So these are some of the things that may cause sudden deafness.
Yep.
When any of these happen, however rare they may be, what time frame are we looking at, and how fast should a patient go seek medical help?
Yeah, so this is the meat and potatoes right here.
Okay.
If anybody's going to pay attention to anything, which
forget the first 6 minutes of
which
this
they
whole
probably
podcast.
shouldn't pay attention to most of this. If they're going to pay attention to anything, this is what it is.
Got it.
You have
The
about
lights come down.
Yeah.
Very ominous. Got
Listen.
it. By the way, both Michael and I have fidget stuff in our hand right now because this is how stressed we are about this topic.
Yeah. In a world.
Exactly.
So you have 3 weeks. About 3 weeks.
Wow.
From start to finish of treatment.
Okay.
So the second that it happens, the next step would be to call somebody.
Okay.
Call your primary care, call ear, nose, and throat, call your audiologist. If it were me, knowing what I know, I would call everyone related to an ear and set up an appointment.
Okay.
Because
like same day, within the hour, as fast as humanly possible.
As fast as you can, because the faster that you can start on treatments, the better off it can be. If it's viral, if it's something like that, what they'll do, many cases is some type of steroid. Okay. And I know I've read a lot of research about this, and my preferred course of action for my patients, and I am not a medical physician. Let's keep that in the forefront here, but my preference when I read the report is that they are getting intratympanic steroid injections. Okay. That means they're literally pushing a needle straight through the eardrum, and they are depositing the steroid at the round window.
Got it.
So then it can very quickly and directly leach into the ear and reduce any inflammation that's caused by whatever's happening, the viral infection. Now, I have seen hearing recover.
Okay.
Secondary to that, if it happens quickly enough.
Okay.
I've also had patients come back and say, this happened about 6 months ago. I thought it might come back. We're done.
Yeah.
At that point, you got what you got.
Yeah.
And that always is painful for me because something probably could have been done.
And the last thing you're going to be like, and if you would have come in, we probably could have helped.
We could have helped.
You don't rub the salt in that wound.
Yeah, I try not to. I try to educate, but
you would like repeat business. Yeah.
Damage is done. Yeah.
Got it.
Yeah.
So obviously the idea of a needle going into the ear is horrifying unto itself for somebody like me.
It's unpleasant, but not as unpleasant as a lifetime of not hearing out of that ear.
So again, not nailing you down to anything that you're about to say here, like typically when something like this happens, what is the percentage of hearing coming back?
That's a really difficult question, and it's completely unknown. Okay. I have had patients recover almost all their hearing. Okay. I have had patients recover a little bit of hearing. Yeah. I've had a couple that just nothing helped.
Sure.
Generally, the patients that come back and say, like, it just is what it is. Yeah. We are now 6 weeks into this thing, and the course of action was oral steroids.
Got it.
And so we didn't take it the step beyond. You have to find a physician that is comfortable in doing that and will make that recommendation.
Got it.
And we'll do the intratympanic steroids. If it were me, I would call everybody to see who does that. It's
there's
not comfortable. It's not fun.
Not enough cups to turn over in that moment.
Exactly.
Do as much as humanly possible.
Be your own advocate and don't wait on somebody to make another referral.
Got it.
Just call around.
Got it.
I don't like to wait in that respect.
Expedite the process.
Don't
just assume your hearing's going to turn off and turn back on like a light switch. If it turns off, that's a major issue that needs to be addressed immediately. Yeah.
Well, let's keep in mind too that there are other issues like Meniere's disease, fluctuating hearing losses, and things like that, where your hearing sensitivity can depress and then recover on its own. I have a fluctuating hearing loss in my left ear. It hasn't bothered me for a while, but every once in a while it rears its ugly head.
Got it.
Hearing in my left ear goes, and then slowly it'll come back. It'll recover on its own without steroids or anything like that. I know that now because I called everybody and went through the evaluation because I thought I lost my hearing in my left ear. But for those patients who are unsure what to do, I would say get in to see a specialist as quickly as you possibly can.
Got it.
Yeah, 3 weeks. I mean, it's tight.
That's a tight window. No pun intended. And because we have officially ruined your Monday with this topic, let's kind of stop while we're ahead and encourage you to go to askanaudiologist.com for any more research you want to do on this topic. And Dr. Michael, I don't know if people are going to love you or hate you for everything that you've said, but you've done an exemplary job today.
My job is to educate.
And you did a wonderful.
It's like being a parent. I'm not here to be your friend. I'm here to educate you and be your parent.
It's not show friends, it's show biz, folks. Great job.
Hey, thanks.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
The only thing I know about this, and I genuinely actually know this, I know that I have my script right here, but I know that dogs hear higher frequencies than humans, and I know dolphins hear higher frequencies than dogs.
There you go.
And that's all I'm adding to the rest of this episode. That's
Going
it.
back to the day.